Hello, this is Dr. Faver here, and I'm just doing this week's teaching moments, and we're going to talk about transepidural water loss. This is one of the things that a lot of times is studied in the science of skin and that. And basically what it is we lose water out through the skin. When we don't have a good skin barrier, then we have issues associated with that. Now that can lead to all sorts of things, from matting of the hair to dried out skin, to a lot of times secondary infections. It hampers the ability to rebuild the skin barrier. So being able to control that becomes very important. So if you've been to any of my classes, I talk a lot about hydration of the skin, which we do by way of humectants. And by adding these humectants, we're actually going to draw water into the skin, and we're going to help supply water or fluids to the cells so that they can stay as healthy as possible. Without this ability, without that extra water, skins and cells are compromised, and eventually what happens, we start getting into infections, irritation, scratching, the whole gambit of that. So it's important that we use conditioners, and we use conditioners that act as humectants, because just adding an emollient, all you're doing is adding oil to the skin, which holds water in, but it also creates a barrier. And by doing that, a lot of times we actually prevent water from the environment getting into the skin and hair and prevent it from doing what it's supposed to do. So I hope that tidbit helps you. We'll talk more next week.